Do you do couples therapy? Do you call in the partners as well, so they come here as a couple?
Yes, I think it's beneficial in many situations. Usually it's also helpful to see the man first, to have a discussion without them having to consider their partner's feelings at the same time. But I do recommend that the partner participate once they are comfortable with it. The reason is that they may have many ideas of what the partner wants, what the partner desires, and what they lack. And hearing it from the partner itself may sometimes give some ease on the couple and also explain some of the things. Because, I mean, it isn't one-sided when I speak with them and I only hear it from one person. And sometimes when the other participate, it contributes with partly more information, but also it can open up new doors because they probably experience it differently. So the partner is a very important part in many of the conversations. But I also sometimes experience that the partner does not want to take part of it at all.
Me too.
Because it's your problem, you fix it. It's like, okay. Are you a couple? Or so sometimes you have to do the best you can with only one part. And I must say that often it's difficult to succeed because I guess there is a reason why the other part doesn't want to participate.
Yes.
And that's probably the reason you should be looking at then the reason that the man actually presents.
Yes, and it puts a lot of pressure on the one with the symptom.
It does.
Because they have to deal with it for themselves.
Yeah.
And the partner doesn't participate and doesn't help in solving the problem, and which makes it very bad. And you may know this. A man comes into your office with erectile dysfunction, says, I don't want my wife to know about it. And I say, how can your wife not know about this? Because she's there with you. Do you have these patients too?
Yes, but not with the woman present. I've had it, but she's there and she's saying, it's your problem. If you want it fixed, then it's up to you. I don't care, more or less. No? I have had the other situation I've only had if he was really with another person and not his wife. But I have had a patient that I remember, I really felt sorry for him because he had this sexual problem and he tried everything to make it work. And he was so sure that was the only reason why his wife didn't want to have sex with him. So he was so fixed on that if he did not fix it, then she would leave him. I just don't think that's the only reason why she didn't want to have sex with him, because I've had loads of couples where for instance, Peyronie's disease, where there was an anger that they could not have intercourse, but they were still sexually active because they loved each other and they wanted to be together. So I think maybe the obstacle was more an excuse for her part than it was actually a problem. And he just couldn't see it, even though I tried to, without saying it directly maybe, but with a...
That can be very challenging. I had a patient last week. He came without his partner because of erectile dysfunction. And you ask all these questions. So it turns out he has 2 kids with his wife. She is not taking any precautions not to get pregnant because she wants to get pregnant. He doesn't want another kid. And he was unable to make the connection with his erectile dysfunction being the reason for not wanting kids. So this is his strongest wish not to become a father again prevents him from engaging into intercourse because then he might father a child. And this is sometimes very difficult to explain to patients. I just had to say it to him. I felt that, okay, it's right before your nose. Just look at this, what's happening, because he had normal erections, otherwise he could masturbate. So everything was normal, but they had a big fight over this issue. And then suddenly it didn't function anymore.
I have a colleague that called it penis wisdom. So your penis is more wise than you are. So like yesterday we had one of the opponents to my PhD, he talked about the man has 2 brains. So here you see how one brain is smarter than the other. So it's funny that she puts it that way, but it's true in a way, no? Because it can also be where you have men that has reduced lust to their wife, and maybe it's actually because the body is shutting down because it's not working. It doesn't mean that you need a divorce or you need to leave her, but it does signal that something is wrong. Maybe it's an unbalance in your relationship. Maybe you fight a lot. Maybe you don't feel that you get the proper support or respect, and you will drag it into the bedroom as well. So sometimes our body is just much wiser than we actually realize.
Yes.
And I think that's an example of it.
Mm.